Hello, so this is our book club presentation for The Immortal Life of Henrietta Lacks. I'm Allison.
I'm Kaylee.
I'm Miko.
I'm Jones.
I'm Caitlin.
I'm Allison.
All right, so the introduction of our book is written by Rebecca Skloot. She tells a story about helicels taken in 1951 without Henrietta Lacks's consent, and it changed the world of medicine and science. Henrietta Lacks was a poor Black woman who never knew that her cells would be used by millions of people after her death. Meanwhile, her family struggles to uncover the truth about what happened to her cells. Next slide.
So we decided to connect some key themes with the textbook. So we have death and grief, ethical and racial injustice, and poverty. Next slide. So with death and grief, as previously stated, this is one of the key themes. In Chapter 11, Death and Bereavement, Bjorklund and Earls highlight the concept of death anxiety, which is the fear of death, which is something the book reflects. As Deborah discovers the impact of HeLa cells and the unethical treatment of her mother, she becomes increasingly worried about her own health. She experiences stress-related illnesses, including high blood pressure and hives, which reflect her deep anxiety about death and disease. Bjorklund and Earls also discuss Stoic acceptance or fatalism in its portrayal of Henrietta Lacks, which is like something that kind of combines with the book, which is when the patient acknowledges the diagnosis but does not seek further information and continues with his or her normal life. Henrietta acknowledged her cervical cancer diagnosis, but did not actively seek any further information about her condition. Instead, she continued with her daily life, focusing on caring for her family. And while she followed the medical treatments prescribed her, there's no evidence that she sought to challenge or deeply question her diagnosis. Next slide. And finally, according to Bjorklund and Earl, Swiss American psychiatrist Elizabeth Kubler-Ross described 5 stages of dying, which are denial, anger, bargaining, depression, and acceptance. So there is denial. When Henrietta Lacks passed away in 1951, her family struggled to process her death. There's a sense of disbelief, especially because she was so young and vibrant as a woman. There's also anger. The family was angry about her suffering and the aggressive nature of the cancer and the feeling of helplessness. Later on, this anger became intertwined with the realization that doctors had taken her cells without consent, but initially it was more about the pain of losing her as she was so young. There's also bargaining, although not explicitly shown in the book, there may have been a sense of if only thinking among the family, wishing that something could have been done differently. Depression, Henrietta's death left a profound void in the family, especially for her children. They faced emotional loss and also practical challenges because she kind of kept the family together. And finally, there's acceptance, which came slowly and incompletely. While the family eventually recognized the positive impact of HeLa cells on science, they continued to mourn Henrietta as a person rather than just a scientific legacy. Next slide.
Next theme was ethical and racial injustices. Ethical injustices in healthcare often come about when certain populations face barriers to accessing medical treatment or lack critical information about their treatment options. It's particularly troubling. Ethical issue is the failure to obtain informed consent, especially when patients are not given adequate explanations or understand their care. Henrietta, who came from a disadvantaged socioeconomic background, lacked the educational resources that many other patients had access to. As a result, she was not fully informed about the medical procedures she underwent, and this highlighted how a patient's background can really impact their ability to make informed decisions about their healthcare, and that can lead to ethical violations. Henrietta's cells were taken without her knowledge or consent and used in groundbreaking research that contributed to numerous medical advancements. However, none of this benefited her or her family in any way, despite the pivotal role her cells played in scientific progress. Henrietta and her loved ones received no compensation, recognition, or even the courtesy of being informed. This exploitation shows a profound violation of ethical principles, highlighting the exploitation of vulnerable individuals for the benefit of others. In situations of racial exploitation, it is essential to challenge unethical practices and protect one's autonomy, even when this means going against someone who is believed to be an expert. Being informed, aware of your rights, and able to advocate for yourself or others helps prevent the manipulation and exploitation, ensuring that you are treated with dignity and respect. Next slide.
The last major theme present throughout the book is poverty. The textbook discusses how individuals and families in poverty experience poorer access to healthcare services. This is reflected in the immortal life of Henrietta Lacks, when Henrietta's STIs and STDs were left untreated, which led to more unfortunate health conditions such as cancer. Henrietta's lack of access to medical care is a severe consequence of the poverty she faced. During the 1950s, Black families had limited financial means, which forced them to rely on public wards and hospitals for healthcare. These wards often exploited their patients and did not provide them with quality care. Poverty combined with racism led to the Lax's family's exploitation. Henrietta received her care at the Johns Hopkins Public Ward, where doctors thought that using these patients as research subjects was fair trade for their care. Without her consent, her cells were sampled and led to many scientific advances. Neither Henrietta nor her family received any sort of benefits from these advancements, which illustrates how poor Black individuals have been subjected to unethical practices throughout history. Next slide.
So similar to how we connected the themes to the book, we also did that with the characters and their traits and connected it back with the book. So the first character is Henrietta Lacks. Her quest for adulthood journey was shaped by economic struggles, racial segregation, and her role as a mother and a wife. For physical development, she was diagnosed with cervical cancer in her early 30s, and Lacks experiences physical suffering with the aggressive nature of her cancer, as well as the treatments that she underwent. And unbeknownst to her, cells from her tumor were taken for research, which led to the immortal Hella cell line. Next slide. For cognitive development, she experienced limited formal education due to systematic barriers, and this demonstrated intelligence in navigating medical treatments, making decisions for her family, and managing her household responsibilities. She trusted her doctors, but was not fully informed about her medical condition. Next slide. For social roles, Henrietta consisted of being a caregiver, a mother, and a wife. She took on certain responsibilities regarding that. She was important for her community. She was an important community member. She was well known in Turner Station for her warm generosity and lively personality. She was a source for support of friends and neighbors. She provided food and care and welcoming home for those in need. For a medical patient in the medical world, Henrietta's role was shaped by racial and gender biases. She was treated as a patient, but not as an autonomous individual with the right to make informed medical decisions for herself. In her case, contributed to the ongoing discussions about bioethics, patient rights, and medical exploitation. For social relationships, again, she had family bonds and relationships with the medical world. Sorry. Next slide.
So for Rebecca Sloop, which is also the author, for her physical within real life and as she was writing a book, she had no health problems or disabilities, and she had a great work-life balance. She had many research skills and intelligence. She was the founder and the president of the Henrietta Lacks Foundation and supports individuals who have contributed to scientific research without their knowledge or consent. She also has a degree in biology and creative writing and has a master's of fine arts and creative nonfiction. She also worked in many places such as emergency rooms, neurology labs, and more. For the social and emotional part, she was very good at communication, empathy. She's very determined and respectful. She interacted well with the family despite how challenging they were at first with not answering her phone calls and just giving her a hard time. She also knows the values in life as a middle adult. She demonstrated those in her writing, and something that stood out was as we get older, we gain meaningful friendships but have less of them.
So another important character was Deborah Lacks, which is Henrietta's daughter. So her quest for adulthood was to understand the truth about her mother's cells. So her physical development, Deb experienced hearing loss as a baby, which all the Lacks children did, and she also suffered a stroke from high blood pressure and high blood sugar. Both could be results of her inbreeding since her parents were first cousins. For cognitive development, she faced a lot of emotional trauma from her mother's death. She was abused as a child and in her marriages. She lived in poverty as a child and an adult. And she also expressed anger and confusion that was tied to understanding of Gila. Through this, she developed many mental illnesses and experienced a lot of extreme depressive episodes, which led to her locking herself in her house for weeks on end. Next slide. So her social role, she was married, children, she was divorced and remarried. So she got married at age 16 to her first husband, and he was 29. She became a mother at 17. Um, she married Cheetah Lax and James Pule. Both marriages ended just shy of their 10-year anniversary. Her social relationships, so she raised her grandchildren. At various points in times, her grandchildren lived with her, but they became full-time live-ins when her son Alfred went to prison. This created a lot of challenges for Deborah as she tried to raise children, worried about her son, and figure out the Lax family, um, their mother cells and things. And then she also had a fear attachment style. She often found it difficult to build relationships, which is very evident as she tries to find a secure and trusting bond with researchers, especially the author. Next slide.
So for a group reflection, we focused on the ethical perspective. There was never consent from Henrietta. However, we found that there was very positives to science and medicine. We believe that she should be recognized. As for racial inequality and injustice, it was done to a colored woman, which we thought was not fair. Um, we agreed that no human should be treated like this. And with family and death, there was a lot of resilience. The children gained many answers, and we are glad that the children got closure. So for my personal reflection, adulthood presents many challenges, such as family closeness, more the soft side of the book with siblings and their mother. The siblings got closer as the book went on. Death and grief. How would you handle your parents dying? I mean, it must have been a hard time, and they really wanted their mom to get recognized, as well as coping skills, um, like how they stayed inside the house versus getting out and learning information, which I thought was really important for their cognitive, yeah.
So, for my personal reflection, I found adulthood to be a time of challenge and a lot of learning lessons. So, letting go of the things that are out of your control, coping with the complexities of life, finding the positive in all situations, building those relationships during good and bad times, developing a process for healing, and identifying the importance of family.
In addition to the previous points, the book that taught me that adulthood requires navigating uncomfortable truths, advocating for oneself and loved ones is crucial. Family responsibilities can be overwhelming, and grief and trauma shape adulthood. So, reading this book made me realize that growing up means confronting difficult and sometimes painful realities. It made me reflect on how many injustices in the world there are and how adulthood means having to process these realities rather than just ignoring them. Furthermore, seeing how Deborah fought to learn the truth about her mother showed me how important it is to ask questions and not blindly trust that systems will do the right thing. You have to be willing to speak up, push for answers, and ensure that your loved ones aren't being taken advantage of. And one of the most eye-opening parts of the book was seeing how much weight Deborah carried in trying to hold her family together. It made me realize the pressure that comes with being an adult, having to support family members emotionally, sometimes financially, and often sacrificing personal well-being to do so. And finally, this book made me think about how loss and trauma don't just go away. They shape who we become based on how we interact with that death and that grief. Next slide.
I think Henrietta's story highlights the importance of accessible education for all. If she had been more informed about her treatment or had the ability to ask questions, her experience could have been vastly different. Education is key to ensuring that individuals can advocate for themselves and make informed decisions about their health and well-being. I also found it heartbreaking that Henrietta Lacks was never able to benefit from the very treatments that her cells helped create. Her cells contributed to the groundbreaking medical advancements, including the development of new chemotherapy drugs that could have saved her life. She died before she could have reaped those rewards of the treatments. She deserved to be acknowledged for the breakthroughs she unknowingly made possible. Next slide.
From my personal reflection, I thought that this story is reminiscent on countless cases of Black people being exploited for the sake of medical advancements without the proper compensation or knowledge. Her story raises a lot of questions about things such as ethics, consent, and of course, again, the exploitation of Black people and people of color. I think knowing the history of people such as Henrietta Lacks is really important and fundamental to understanding the relationship between Black people in the medical field and why there's so much mistrust built up. And for family, I think that Henrietta Lack's story is not just about science and ethics. It's also about the deep bond of family and the need for recognition and the fight for dignity and justice across generations. And also, their story just illustrates how medical injustices don't just affect individuals, but it ripples through families and shaping their experiences and different struggles. Next slide.
A key takeaway I had from the book is that adulthood presents a variety of challenges, and every adult navigates these challenges differently. One of these challenges is how people handle grief. Henrietta's daughter Deborah had a complex journey with grief of her mother. She longed to know more about her mother, and the journey of learning Henrietta's story was painful but healing for her. Henrietta's son Zachariah had a slightly different grief journey. His grief journey was more driven by wanting justice for his mother compared to Deborah. The last challenge I found is self advocacy. Henrietta was a marginalized patient who was not fully informed about the medical procedures being performed on her. Adulthood teaches lessons such as when to self advocate, especially against an authority figure like a doctor. Next slide.
And these are all the resources that we use for our presentation as well as just for reading. Thank you.